Hey, everybody, welcome back to the Fitness Athlete Podcast. We're happy to have you here. I'll be your host today, Alan, and we have a brand new guest here on the Fitness Athlete Podcast, Dr. Sam Deering. If you don't know Sam, she's been teaching in our live course for a little while and recently joined us last fall, so actually almost a year ago now, helping teach in our Level 1 online course. We have a lot in common. Sam is a graduate from Eastern Michigan University in exercise science, which is where I did my undergrad, and then is a graduate from the same grad school program at University of Michigan for PT as well. So she's a physical therapist up here near me in Michigan. She is the co-owner of Onward Ann Arbor. She's a CrossFit Level 1 coach. And so like a lot of us here in the fitness athlete division, bouncing back and forth between coaching, treating in the clinic, a little bit of clinic ownership, and then also teaching here at Ice Physio. So we're super stoked to have Sam on our team. And we invited her here because Sam recently had shoulder surgery. And so I think this is a really good topic to unpack, and also a good, I think, learning experience for maybe those of us who have only interacted with folks who've had surgery from the patient lens of what is it like to be the clinician, and also maybe explore some of the rationale behind what happened before surgery, the choice for surgery, but also what's happening now that surgery has happened. If you maybe you can't tell in the video because she's wearing black on black, but she's got her sling on right now. There she is. And I think this topic is relevant because I think we're experiencing a little bit of a pendulum shift too far in the wrong direction around surgery, that we have kind of as a profession slowly adopted a 100% anti-surgery mindset that PT can fix anything. It doesn't matter if you got ran over by a car or whatever happened to you, that you just need to go to PT and PT can fix you. And obviously, we always support a PT first mindset, but what is the indication when someone may need to choose surgery for their own personal goals, or maybe us as clinicians? What do we look for, especially in a really active individual like Sam, a fitness athlete? What may trigger any sort of flag in our mind that maybe surgery might be the best choice for this patient? And what does that discussion look like? So, welcome, Sam. Do us a favor and I guess start with, what did you have specifically done? And then, if you would, kind of take us through what was going on before the surgery and maybe your rationale for why you had surgery to begin with.
Awesome. I am super excited to talk about this just because I definitely was in that bucket even as a PT. Like, I'm kind of anti-surgery. And then I had all this happen, and I'm like, wait, how I want my life to look is not looking that way. And we might have to go down that surgical rabbit hole. So, and even in PT school, so many of my classmates have had ACL repaired, Achilles, some kind of shoulder thing. And I was like the one person without a broken bone or some kind of surgical intervention. I'm like, oh boy, am I going to be a good PT or not? And not that I want to go through this, but it has definitely, even the past month, very eye opening of what surgery even entails. So I am 6 days post-op now. I had a labral repair, so I ended up getting 5 anchors put into my labrum, 3 in the front, 2 in the back. And then they had to take my bicep tendon, which we know attaches to the labrum. They ended up choosing to move it down to my humerus just to kind of reduce re-tear rate, and the strength differences aren't that big. So I thought that was a good way to go. So that's what I had done 6 days ago.
Okay.
Yeah.
Before we get into your rationale, I love that you said, "Hey, I know a lot of people have had surgery in my class, and I felt like, can I still be a good PT
Mhm.
if I have surgery for myself?" So that's really why I wanted to have you jump on here and unpack that, because I think that's maybe what some people might think about their own issues, but maybe others might be thinking about people who do go on to have surgery who are rehab providers.
Yeah, I think you have some good insight, and I still feel like I've been a great PT overall. But in terms of post-op care, and I'll get into it, but I did not realize how much we are not kind of even explained what to expect before surgery, during, after, and even being a PT. Like, I've seen Rebecca a couple times now, and I'm like, is this good to do? Should I do this? Like, what are we looking at? So, but I'll kind of start with what led to needing surgery.
Okay. Yeah.
Last November, which is like a good 8 months, whatever ago, I was playing volleyball and I usually set. So I'm not typically wailing on the ball a ton. I'm just like setting up the hitters. And I got invited out to play outside hitter that night. And as a setter, I'm like, let me just take full opportunity to go and show them what I got, right? I remember thinking too, like, "Ooh, I should get there early, warm up my shoulder, like do all the right things." I end up getting there a minute before they blow the whistle to serve the ball. So already off to a bad start there, right? And so fast forward, it's like game three. I go up to hit the ball, and you know how we ask patients, like, did you hear or feel a pop? Well, I never knew what that truly meant until I heard and felt a pretty substantial pop in my shoulder.
Mhm.
And I remember coming down, I did get the point, which that was the most important, but I remember coming down and just feeling like my arm is dead and like I couldn't move it. It did not feel like it was in place. So I'm trying to like push it back and make it feel kind of comfortable. And at the time, I'm like, okay, give it a second. We'll KT tape it, like any good PT would do and get back out on the court. I ended up sitting out the rest of the night. Like I just couldn't move my arm. So I go home, I'm talking to Aaron. Aaron's my husband. He's also a physical therapist. And I'm just like, I felt and heard a pop, but I'm not the one to immediately be like, let's go to the ER and see what's going on. Like, let's just see how the next couple weeks go, and what my function is. So that's kind of how this happened. And I remember having a live course with Gmo coming up in like December, January. I'm like, I have to demo all the pull-ups for this, and I don't know if I'm even let alone going to be able to hang from a bar. So I started PT. I was able to hang from a bar, but then at the live course, I was going to show some kipping pull-ups and it popped and I couldn't move it again. And at that point, I was like, okay, this might be a little bit more serious than I think it is.
Well, Sam, walk us through your timeline from acute injury at the volleyball game to when did you decide, hey, this isn't going away. I need to do something a little bit more structured. So starting PT, but then also how far into the future was, what sounds like basically a re-injury of the same condition.
So November injured my shoulder. December and January, I'm rehabbing it. I'm seeing Dr. Rebecca probably twice a week to get some dry needling, do some stability work. I'm able to raise my arm fully overhead, so that's pretty good news. And then January, end of January, I go to the course. I kind of re-injure it, come home, and I'm like, okay, I'm gonna really hound PT a little bit more because I'll be honest, I was being a little lazy with my home programming, all that. I'm like, I gotta be serious. I'm coaching classes. So February, March is when I go, I really think I'm considering surgery or something at this point. Like, let me get an MRI.
Okay.
So that was kind of my deciding factor. I gave PT a really good shot, I felt, and like it was getting where I could raise full motion, do basic strength, but I could not even touch a pull-up bar. I couldn't hit overhead for volleyball. And so those were the two big things where I'm like, that's a big part of my life, and I think I need to investigate further.
Okay. So, I mean, from my point of view, I feel like you did everything we would ask a non-PT patient to do. That you didn't go right to the emergency room. You didn't get an image right away. It sounds like you gave it several weeks to months with some improvement, but it also kind of sounds like every time you tried to progress out of basic rehab, you experienced a re-injury or just could still not do the stuff that you needed and wanted to do, both as a coach and an athlete.
I also kind of forgot the part where I fully sent it for the CrossFit Open.
Here we go.
The amount of KT tape I had on my shoulder was unreal, and how my chest to bars and ring attempts for a muscle up looked were not great. But I wanted to get through that as an athlete. I'm like, I don't care what this MRI is going to kind of show at this point. Like, this is my season to kind of get through that, and then I will figure it out from there on. So,
Which, taking your PT hat off is exactly how we see a lot of our athletes that we see in the clinic behave. That they do their best to stay in the gym with our encouragement and our help, and maybe they do come in for a visit and get evaluated and get some homework to do. But it comes time for something like the Open that is only one workout a week, only comes around once a year, is only really now 3 workouts. And even though we might say, hey, the open is coming, get those boo-boos fixed now. They show up on Friday morning and say, hey, I know I'm going to do the open workout in a couple hours. I know you don't have time to see me. What can you do for me in 17 minutes? And I think those are the moments where we stand out as the provider choice for the fitness athlete, of not turning them away, but also understanding, hey, if I wasn't sitting on the other side of this table from you, I would be behaving the same way. Like, it's
Mhm.
important for me to do the open workout no matter how I can get it done. And I recognize that might come with some consequences, but I'll deal with that in a couple weeks.
Exactly. Yeah, so we geared up and did it. From that point on is when my shoulder on a weekly basis just started to sublux whenever it wanted to. Like I just would be walking. I like to say, boop, it came out of place. That's kind of my catchphrase for the month of it. I
Now,
remember,
did you have that happen before this? Did you ever experience that prior to this injury?
I mean, I know with being an overhead athlete, like I had a little more mobility, but like I would get really bad tendonitis. I know what that feels like. This did not feel the same. I never had where I'd go up and feel super apprehensive, but I was like, any of this position, I just did not even want to mess with it. So
Okay.
it was
What's
basically
your, let's
shoulder.
back up. What's your background prior to CrossFit? You said overhead athlete. Tell everybody what you did prior to CrossFit.
Growing up, gymnastics, volleyball, and basketball, but mainly the first two. So
Okay. So yeah, you're the person who shows up that's maybe a little bit more mobile, and I would say historically trends towards a subluxation than others. But it sounds
yeah.
like this is kind of the first time you started to experience a chronic problem with it.
Yeah. And even just simple things. So that was kind of the scary part of like, I don't know what my shoulder's going to be like on any given day. And let alone like I'm treating people, I'm using my hands and my arms a lot. So when it started to become very achy or like I couldn't trust demoing things or working on patients, I was like, yeah, this is starting to really affect my life a little bit more than I would like it to.
Okay, so take us forward from the subluxation start. Is that when you kind of begin to investigate surgery? You mentioned getting MRI. Where did that show up in this kind of timeline?
That was around, so March was the open. April's where I'm starting to set up the, meeting with the ortho because it takes forever to freaking get into them anyway. So I'm like, let's just get it on board. I'll keep doing my PT. So I sit down with them. I get the MRI finally kind of in April, May-ish. And so it comes to find out, like, I'm like, it's my labrum. Like, I don't know what my rotator cuff looks like or my muscles, but I know for a fact my labrum's just not doing very well. And so sat down with ortho. I've treated a lot of my surgeon's patients. I have two other friends that have seen him for the same surgery that are doing phenomenal now. So I had a good feeling going into it. And he's like, he sat me down, he drew out my labrum, showed like that it was kind of the whole top portion just gone. And was like, your rotator cuff is fine. Your muscles are all good. Like, that's a good place to be. You do not have to get this surgery. Like you can function your ADLs and do the rest of your life how it is if you want, but if you want to do CrossFit, hang from a bar, handstands, volleyball, like this is my recommendation would be to get surgery. So,
And I mean, you're for those who don't treat this shoulder very often, and especially in the fitness athlete, you're describing like a textbook case of a slap tear, a superior labrum. You fit all the indications of an overhead athlete that is prone to labral injuries. And you described for people like I don't work with this population a lot. What kind of would cue you into a labrum issue without an MRI? Would be how you subjectively described your arm as dead. We call that CrossFit dead arm, but that's not just associated with labral injuries in CrossFit. We see that in gymnasts, in cheerleaders, people who are on their hands a lot, holding load overhead or inverted. We also see that in populations like baseball throwers too, and they all have that common subjective finding themselves of like, man, hey, that's what they're telling you when they come into the clinic. My arm just feels dead, and even sometimes if ignored, if people blast through it, we actually have a case study around this patient presentation in our level 1 class that if we ignore it for months or years, we tend to see people develop radiating pain, paresthesias, and even the end stage is kind of numbness and tingling of basically the whole arm.
yeah, not fun.
Okay, so surgeon says, hey, you can take care of yourself at home and work a desk job the rest of your life. You don't need surgery, but if you want to get back to more higher level stuff, then surgery is the way to go. Is that the point at which you decided to get surgery?
Yeah, I mean, just kind of there was an easy decision. I'm like, there's no great time to get it done, but with how it's tracking, like, let's just get it on the calendar.
Okay. So you just had it 6 days ago.
Hmm.
We're never supposed to date ourselves on podcasts, but it's like the middle of July. So in that 2 months between meeting with the surgeon and scheduling the surgery, I assume you kept doing some rehab stuff, but
Yeah.
was there ever a point in that time where you second guessed the decision to get surgery, or that whole time were you thinking, this is just helping me manage my symptoms to get to my surgery date?
I was pretty excited for it at this point, being like so many months into rehab and knowing that I've really like given it a good shot. Originally, when I was still doing PT and working out at CrossFit, like I was so bummed. Like the workout of the day has pull-ups and pressing overhead and snap, like all these things that I can't do. And I was very focused on what I can't do. But then
Mm.
as soon as I kind of got to the point where I'm like, okay, I have surgery on deck, these are the things that I can focus on. Like running actually didn't really bother my shoulder. So I was like, cool, I can build my engine a little bit. Every day can be leg day again, which is my favorite. So, I couldn't really hold the barbell for back rack, which was kind of surprising at first. So I'm like, we'll just modify how we had to. But I started getting a better mindset of like what I could do versus what I couldn't do, knowing that recovery will be a lengthy process, but it's going to be a heck better than like I can't do any of that now anyway. So,
I love that reframe. And we typically tell that to patients who are hopefully also making progress with their chief complaint. Like, let's focus on something else right now. And I think that's great for just athlete psychology in general. Instead of focusing on maybe the perception of what I'm losing because I can't do stuff how I want to do it, or I have to do it modified, of what can you do and what can you get really good at until we can get back to lifting overhead or pulling overhead or running or whatever their issue is.
yep, that was helpful. I was very frustrated at first, but then when I realized the things that I could work on that probably aren't my favorite thing to work on anyway, a good season just to get better at it.
And I love that you said that because I think that's something where we can be of help besides everything else we do with someone, because sometimes people go the other way if we can't help them reframe what's happening. Of sometimes we see people, and I think we've all been there with an injury where it feels like our movement library is continually shrinking. And I think if we're not careful, that can be the transition point where a person stops CrossFit. They stop a healthy habit because they feel like they start to tell themselves this is not for somebody like me anymore because I'm injury prone or I'm too old or too stiff or whatever. They start to talk themselves out of the thing they may have been doing for quite some time.
Which is awful because I think of like my CrossFit community, just going to the gym to see my people is a lot of the reason I show up. And to think of somebody who's going through an injury and then removes themselves from their community, like the downhill trajectory of that is not something I would want anyone to kind of enter into.
Yeah, but and I think people self-select out of it after so long of, and I hear this a lot when I'm coaching. I hear a lot of people apologize to me for me needing to help them modify. And I always reinforce, hey, that's literally my job. As
Hmm.
much fun it is when it's a rather simple workout that everybody can do, and I can just run around and scream at you to go harder. Like my main job is to make sure that when you come here every day, there's an option for you to do so that you feel like you can come here every day and get a very similar workout to everybody else so that you don't become that person who slowly talks yourself out of it and finds yourself doing whatever you can to keep active, or worst case scenario, become a sedentary person as a result of an injury.
Absolutely.
Okay, so take us, I would love for you to take us through the surgical process because I think if you're listening and you haven't had surgery and maybe you didn't get a chance to observe the pre-op and surgery process in school, I always tell people my greatest memory of surgery is observing a whole day of hip and knee replacements with a team of surgeons at a hospital that I did a acute care rotation at, and just amazed by how quickly they did them and how especially when it taught me a lot when I would go to the patient's room in the afternoon and they were waking up from anesthesia. And they would always say stuff like, my back is killing me. And I would say, well, I saw the needle that went in. It makes sense for your anesthesia. And then also, they would say, gosh, it's so sore. And I would say, well, if you could see what I saw, like how they cranked on your knee or hip, you would understand why you feel the way that you do. But I think, as you said, even as a PT, you don't have an insight into that until you're in it. So I would love for you to explain if you got any pre-op education or exercises, what that looked like, and then what surgery day went like, and then also what your acute follow-up with your surgeon looked like.
Yeah, and I don't know if my story is a little different just because my surgeon knows that I'm a physical therapist or whatnot, but it was pretty eye-opening. Like, I maybe spent a total across like maybe 3 visits, including setting up the MRI, reviewing the MRI, and then kind of surgery day, like maybe 30 minutes max with my surgeon. There's a lot of other parts in it, but so I did not. I set up my surgery after having that MRI review, and then I did not talk or see my surgeon until game day. So it was pretty much like keep doing your PT or whatever you want to be doing, but then we'll see you on surgery day. And so I get to the hospital. They take me up to the like pre-op area. The nurses kind of and anesthesiologist review everything they're going to do in great detail, which made me feel really comfortable because I didn't really know what to expect. I knew I was getting a nerve block. I had no idea what a nerve block really like feels like or does. So they
Had you
went.
watched any videos or anything?
I was tempted to, but then I was like, I don't know if I want to freak myself out anymore.
Talk
Like,
yourself out of it?
yeah, like I don't know, because they were like, well, if you get the nerve block, you don't need a pain pump. Like we can just kind of get it done. So, and I mean, I'm a big fan of dry needling. I'm not afraid of maybe needles around my neck, but when they say they're going to go through here, I mean, I know there's a lot of vasculature there. So I got that done, and then they were like, "Yeah, your surgeon, you'll be in there for maybe like 2 hours, and you'll wake up, and as long as you're feeling good, you get to be on your way." And so with all of that, I wasn't given any like post-op instructions except for a printout of here's your protocol to give your PT. Your nerve block should wear off in like 12 hours, and here's your like pain med plan, essentially.
Okay. We had Madison on a couple weeks ago and talked about post-op protocols. So I would love for you to discuss, was it just handed to you? Was it explained at all of if you could skip parts, or were you just given a printout and told to come to your follow-up appointment?
I was given the PA on the case. He's actually one of my friends from high school, so he sent me it before and was like, "Here's his general like post-op plan for a labor repair so you can review it." And they were like, the first 2 weeks super important to follow kind of verbatim. The game plan, stay on top of your pain meds, stay in your sling. If you're at home, like you can take your arm out and let it hang so your elbow doesn't get stuck in like a bent position, but a little bit more cautious because we don't want to disrupt what's going on there. What will be interesting is going through kind of week probably 4 through 12 for me, because I know based on symptoms and irritability and respecting tissue healing that we might be a little bit more aggressive in terms of the fact that like my rotator cuff is not involved. Like my muscles are all pretty safe and sound. So he kind of was vague, but I think intentionally knowing my background and how I rehab that I can have control on how I progress.
And this is fascinating for a couple of reasons. First of all, because it's pretty much exactly the story I think we could say we've heard from basically any patient that's ever had surgery. Of I almost never saw the surgeon, and even my follow-ups, as long as everything's going well, I may never see them again, which is often something I tell patients when they're worried the surgeon will be upset that we're progressing beyond the protocol. And I always educate them, if you're doing well and you're ahead of schedule, you're not going to see the surgeon because they're not going to spend any time with you because you don't have any issues. You're ahead of schedule, you're going to see the PA, and overall, you might only spend some time before and during the surgical procedure with your surgeon. But I think too, it's interesting you say that it was kind of glossed over a little bit because they knew you were a PT. Imagine what our patients receive when they go in and nothing about their background tells the medical team that they have any healthcare experience. Imagine you got very little, imagine what the average person gets. You probably got a little bit more, and you got a little bit more leeway because you are a PT, but imagine what a general office worker or whoever might get.
Right, which makes me realize how awesome and important our job is because we get to like the surgeon's just doing like carpentry, like they're repairing it, but we're the ones that get to kind of mold it into what it gets to be and what the patient wants it to be. So, asking about sleep, nutrition, how things are feeling, what questions they have, especially that first day. Like I saw Rebecca, like most people could say that first session feels kind of pointless in a way because you're just checking incisions and stuff, but that whole time maybe we're not doing passive range or a ton of stuff to the actual shoulder, but we're talking about all those questions and seeing like how can we best prepare you from this beginning step to where you like want to ultimately be.
I really like what you just said, that they're doing the rough work, but it's up to us to kind of create the final product of like the contractor's just going to come in and hang the drywall, but it's up to the PT and the patient of what that room is going to look like once it's basically a clean slab ready for remodeling, so to speak.
Like I feel like we should get paid for some of their surgical interventions.
So post-op, how soon after surgery, understanding you're just 6 days post-op, how soon after surgery did you go to your first PT appointment?
I got surgery Friday, so 3 days. They
Okay.
say between 3 to 5 days. So
Which I think is more aggressive than we see with most protocols. Some people are not starting until 2 to 4 weeks. Some people are not
yeah.
starting until their protocol says they can get out of the sling. So I would say coming in, surgery on Friday, PT on Monday, that's more on the progressive end than we even see.
Yeah. I mean, my first follow-up with the PA isn't until 2 weeks post-op. So it's like pretty substantial amount of time of if you have questions, you better have someone that can answer.
Or you got to be that person advocating for yourself and calling and trying to get a
Mhm.
hold of the surgical PA or the surgeon. What
Yeah.
did your first visit look like? I think it maybe looked probably a little different than at least some patients are used to.
Yeah, so I mean, especially since Rebecca saw me prior to surgery, like she already kind of knew a lot of my background. But I came in, she took my surgical bandage off, made sure all the incisions looked clean. We did some very basic kind of like pendulum swings and stuff just to assess like how it feels to get a little bit of movement in there. And then just talked about like how has sleep been? What's comfortable, what's not comfortable, making sure the sling is actually fitted correctly. Because I know, oh my gosh, the amount of people I saw with a knee immobilizer or something after surgery that you're like, that's supposed to be on your knee, not your shin. But, anyways, just
It's
making
on
sure.
backwards, Tom. Come on.
Yeah. And then actually, like, we didn't do this day one, but I did see her kind of later in the week where my neck has just been killing me, obviously, from wearing this damn thing. So, like, she'll dry needle my other side, and we've been doing some exercises on the body parts that still kind of work. So, which is nice because I am not one to take pain meds, and they want me to take a ton, and it doesn't make my stomach feel good. But I was able to get on the bike for a little bit and have, like, no pain for a couple hours just getting my heart rate up. So,
I love that. And that's why I tell people I want to see you as soon as you feel comfortable. I don't care what your surgeon says. As soon as you feel comfortable, I want you to come in because even if we can't do anything with that arm, we can get you on the assault bike with two legs and one arm. We can get you doing seated stuff on the skier or put your foot up on the rower on a skateboard if you can't use one of your legs. Like we can be really creative post-op. And I really think that's where PT has a lot of value, especially in the fitness athlete. They're used to feeling good because they move so often, and we don't want them. Obviously, we don't want anybody to get addicted to painkillers, but we want them to choose exercise as the pain relieving modality. And for a lot of people, it's just education that this is okay. You're not injuring anything. And if you feel great for a couple hours after, then just do this 2 or 3 times a day, right? It really makes it easy for people to buy into the homework, especially as you mentioned early on. It's kind of low level and boring that some of those first visits for some people are just checking your incision and maybe squeezing a ball and maybe some passive modalities like a heat pack or some e-stim or something like that. Where I think our value, especially to the fitness athlete, is how creative can we be in getting them moving as soon as possible after surgery?
Absolutely. And I think too, it helps with like, I've realized sleep is the hardest aspect of like the first couple days after surgery. But that night, after being able to get on the bike and move my body, like I was able to sleep so much better and not rely on pain meds either, which was super helpful. And I think that just, again, we're trying to recover. And if we're not doing anything, like sitting on our butt is not helpful either. So.
What besides PT and besides trying to get to the gym and move how you can, what and that causing better sleep, what other stuff, if anything, have you changed about your recovery? Are you, I assume, taking some time off work, but have you changed nutrition or anything else like that just to help facilitate your recovery even more from baseline?
I'm definitely focusing more than I have been probably on nutrition because I know that's one of my circles of control. So, like, just not a lot of sugar, just things that cause inflammation anyway. And we don't need to add more. So, I've been good at that. Because I'm not moving as much though, like, I usually have a really good appetite and I'm just like, I'm just not that hungry, but I need to eat, right? I've been still doing like stuff for work, like admin wise, and helping with like coordinating patient care, but I can't treat having only one arm. So I'm taking 4 to 6 weeks off of work, which I'm very thankful for Erin and Rebecca who can help cover. But that's honestly the hardest part of the surgery is me having to take away from a job I love and not be able to do my thing. So
I like what you said, having a circle of control, because I think a lot of our patients feel like they can't do much early on, and it can be easy to just kind of like, in my mind, and maybe this is a little bit stereotypical, a post-op patient is someone sitting on the couch watching a lot of TV, and maybe even, the room is dark. Maybe they haven't changed their clothes in a couple days. They can't remember the last time they showered. And they kind of almost look like, if you didn't know they just had a major surgery, they would kind of look like somebody starting to fall into depression. And so I think it's really profound, you said, and I think it's important that our patients hear that from us education wise. There is actually a lot of stuff you can do. It doesn't feel like you're doing anything because it's not exercise, but there's a lot of stuff you can do not only to control your symptoms and your pain, but also accelerate your healing and recovery.
yeah, I think that comes down to trying to stay social somewhat. So I know I still pop into the gym and say hi to everyone and talk with them. I've had a lot of patients give me puzzles or books, just knowing that, I might have to preoccupy my mind a little bit, but
Yeah.
even just going for walks and visiting with family has been great. And when you have surgery, you kind of have a free pass on them just like doing anything and everything for you, which is nice. But
Do you have a bell for your husband?
honestly, I should get one. He might, that would not go over well. But not much has changed. Like he does cook and do laundry and all that. So he just does a little bit more of it.
Okay. So, what are your plans? Obviously, you're in PT now, you're about a week post-op, so it's still fresh. Like, I assume knowing you, your rehab goal is nothing short of full recovery. Is that fair to say?
Yeah, I'd love to get back to, I know down the road, muscle ups and playing volleyball, although I'm not like a collegiate level, but like the leagues are pretty intense. So I'd like to be able to participate and play with my friends again.
Which is, again, if you were any other patient, not unrealistic goals. Cool. I think this was helpful. I saw that you were getting surgery and then been following your post-op journey. And I think this ties in really well, as I said, with our last episode with Madison talking about post-op protocols and just helping people understand like this is your case, I think, is what shows up in my mind of maybe not go straight to surgery, but definitely an indication for at least referral or even a second opinion from somebody else in the clinic of this person is checking all of my boxes and they're either not getting better, or in your case, it kind of seems like there's stuff they just can't do. And maybe they're also regressing despite reducing their movement library at the same time.
I agree. And I think that's the biggest thing I've learned from this is one as a PT, like I don't have to automatically be like, hey, we're never going to get surgery. You're going to be so good you won't even have to need it. Well, at some point, if they're again regressing or not doing what they want to do, maybe surgery is part of the plan. But then as just a human being who is an athlete who used to think, oh, I'm never going to get imaging or get surgery because like I can do all the things, just knowing like giving yourself some grace and that those things are there if you need them. So,
And I think, too, what's a benefit, if we can call it that, is that you now have a really great experience to share with other patients, athletes at your gym that you coach, that you can explain the whole process start to finish for what it looks like to have a labral injury, what you experienced that led you to choose surgery, but also be able to answer those questions for people and explain, like, here's literally step by step what's going to happen. You're going to get an image, you're going to meet with the surgeon, you're going to do some pre-op testing, you're going to get a nerve block. Here's what that is, what it feels like, and then here's what post-op, at least if you come get treatment with me, here's what post-op could look like. And I think a lot of people don't get that insight, or either they don't get the insight and they have the surgery anyway, or maybe folks constantly try to talk them out of surgery despite them being, all things considered, a good candidate for the surgery.
Right. I had a lot of people ask too, like, are you kind of mad at yourself for not, when it first originally happened, going and getting imaging and then just getting the surgery? And to be honest, like, I don't have much insight yet, but my gut feeling is if I had not gone through all the PT I've done to get it, where it could be, I don't know if my recovery would even feel this great right now. Like, I barely have any pain. I'm already starting to move it around. Like, I'm feeling very confident that my recovery process is going to be so much stronger and a little bit more efficient from going through all the PT that I did to get it where I want to be. So, yeah, I'm not mad about it. I'm happy that my kind of timeline ended up exactly how it was.
And I think that's a really good opportunity too to pitch to those people when they're considering surgery, or as you said, it's not, in most cases, it's not like you call on Monday and you have surgery on Friday. It's sometimes weeks or maybe even months away, sometimes even just to get that initial image to start the process. And I think that's a great time to tell people, like, don't stop PT and just go sit at home and wait for your surgery date. Like, keep coming here because we can continue to strengthen, we can continue to increase range of motion. And that's just going to make your recovery on the other end that much faster. Like, I think of all the patients I've seen over the years who came in for prehab, who walked out the door to go to surgery and looked 80% that they did not have that injury. Even to the point where I used to work at a hospital where we had a program called Joint Academy, where people getting total hip and knee replacements came in and did 20 minutes of basic exercise 2 to 3 times a week. And they would show up to their pre-op appointments, sometimes pain-free, and cancel their surgery. But otherwise, which that led to the program eventually getting canceled. but the people who went through the surgery were the ones who, when we walked in to evaluate them after they were waking up, they were the people who were up and walking without a walker. They went in with a higher capacity than the typical surgical patient does, and their recovery was so much better. Less pain, more motion, more mobility, more independence, less time, all said and done, in rehab at the other end. And so saved them time and money by sticking with PT before their surgery.
It's amazing. It's amazing
Yeah.
what you can do and where you can get. So,
Well, Sam, thanks for your time. It's awesome to hear your perspective. We wish you the best of luck in your rehab. For those who don't follow you, I know people can reach out to you on the Ice Physio app, but what is your Instagram handle?
samdeering.dpt.
Okay, so if you want to follow her rehab, you can follow her and see what she's doing. Other than that, we appreciate you all listening, and we'll see you all next time here on the Fitness Athlete Podcast.
Thank you.